And in just a few hours, Health and Human Services Secretary Robert F. Kennedy Jr. will head to Capitol Hill, where he's going to testify before the Senate Finance Committee. The hearing gives lawmakers their first chance to question Kennedy on his recent moves, including the ousting of CDC Director Susan Monterez and the changing of COVID vaccine recommendations. One of those lawmakers on the committee is Republican Senator Bill Cassidy of Louisiana, a doctor who cast a pivotal vote to confirm Kennedy. The senator had said he would conduct oversight of the health secretary amid the chaos at the CDC, but declined to elaborate in recent days on what exactly that means. Ahead of this morning's hearing, two Democratic senators, Finance Committee Ranking Member Ron Wyden of Oregon and Senator Angela Also Brooks of Maryland, also are releasing a report titled Costs, Chaos, and Corruption, 203 Days of RFK Jr.'s Disastrous Leadership. Senator Also Brooks will join Morning Joe this morning to discuss that report. But it comes as Florida is moving to eliminate all vaccine mandates, including ones for children to attend public school. This would make Florida the first state to end a long-standing practice of requiring certain vaccines for students, which public health experts say help control the spread of infectious diseases. The state's Surgeon General announced that decision yesterday while railing against vaccine mandates.
Every last one of them is wrong and drips with disdain and slavery. Okay? Who am I as a government or anyone else, or who am I as a man standing here now to tell you what you should put in your body? Do you want to put, whatever different vaccines in your body? God bless you. I hope you make an informed decision. You don't want to put whatever vaccines in your body? God bless you. And I hope you make an informed decision. And that's how it should be.
That move is drawing quick condemnation from public health experts like the president of the Academy of Pediatrics, who said this will put children in Florida public schools at a higher risk of getting sick, and it's going to have ripple effects across their community. Meanwhile, the Democratic governors of California, Oregon, and Washington state announced yesterday they're forming a public health alliance in response to the turmoil at the CDC. The West Coast leaders say they'll provide credible information about vaccine safety and work to provide unified recommendations to, quote, ensure residents remain protected by science, not politics. I want to bring in now vascular surgeon and associate professor of surgery at Harvard Medical School, Dr. Anitha Dua. Let's start with this news out of Florida, doctor. As a surgeon, what concerns you the most about it to end vaccine mandates, including for school children in that state?
Well, if you go back a century, basically vaccine mandates and the vaccination campaign is the #1 reason why our children today are not 6 feet underground because of diphtheria, polio, and measles. And actually what we've seen just over the last 203 days, you can see how quickly a decision like this can actually spread across a state or a country. We already saw the most number of deaths and the most number of measles that we've seen in years, frankly, here. And that's just because of a little bit of misinformation. So something like this has the capacity to really affect the 2.8 million children who go to public school in Florida.
Well, when you hear the Florida Surgeon General, which you have a title like that, and people are going to take what you say very seriously, in addition, of course, to the actions that he's taking. But when you hear him speak about vaccine mandates like that, saying basically, who am I to tell you as a government what you should put in your body? The other question on the side of it is, who am I as a government not to offer protections or basic rules for the community at large? What do you wish that he and others understood about the efficacy of vaccines and why these rules are in place in the first place?
Well, to be honest with you, the saddest thing is that I think he does understand vaccine efficacy. The problem here is that he's completely politicized. That is the problem. He said, this is like slavery, which is ridiculous, first of all, so I'm not even going to touch that. But he then went on to say, who am I? Well, the government also tells us not to put cocaine in our body and not to take heroin and when we can drink and drive and things of that nature. So if the government's job is to protect you, which is why they have those other laws, then this is absolutely within the remit. And remember, this is the government elected by the people, and we elected you to protect us. And this is one of the most dangerous things. And, I'll tell you right now, this is not hysterical. This is a fact. If we do this, we are going to see an explosion in certain diseases that we've already actually eradicated. And it's really sad that the COVID vaccine really is being confounded essentially with all these other vaccines that we've been using over the last 100 years. And it's basically just been a way for influencers and people like RFK, who again is a lawyer, not a doctor, to come in and say this is the thing to do versus that. It would be the equivalent of me as a surgeon going to the Supreme Court and saying, I think you guys should change this law because I saw it on TikTok, and then violently going and pushing it forward. And whether it's ignorance, it's stupidity, or it's malice, at the end of the day, people are going to get hurt.
And I think that's the warning that we've frankly heard from public health and medical experts. You're echoing that here on this program. I think Florida, when you talk about the politics that are involved now in public health, Florida has always prided itself on being a place that's sort of a conservative policy incubator. That's what I, as someone who follows politics, sees in this move. And then on the West Coast, you've separately got those states out there forming a public health alliance of sorts to provide vaccine recommendations. Is that something that you feel would be effective? And what's the risk then of basically states that have a patchwork of their own rules around something like public health that doesn't actually respect state lines or borders?
The first danger is that you've got people, of course, who are going to be moving around from place to place and can get affected if they do something of this nature. The second thing is, of course, it's unfair that some states get to have good rules and some states get to have bad ones, especially about something that is a federal issue. Because at this point, I could have my child, for example, in school in Massachusetts. They get vaccinated. I then go to Texas where, in the outbreak, for example, half the kids in that school that had the outbreak were not vaccinated. And you can, again, see how quickly that spread. And then I take my child to a school like that, and the herd immunity, which is mandatory for this to work, you need to have everyone to kind of be on the same page, is no longer there. So the vaccine that I gave my child in X location, first of all, becomes less effective because there's more people with the disease. And of course, it's unfair to the children in that specific state who are not getting what they need. This is a major problem. And I think, politics are okay. We can do it, but let's leave the kids alone. Let's not use them as pawns to do this fight. Adults can decide, but little children that need to be vaccinated to protect them against diseases that they don't have the immune system to be protected against, this is a really dangerous thing.
Yeah, and this is, again, the dire warning that public health officials like yourself are giving in light of the decisions in Florida, but then also the ways that the CDC has been, frankly, dismantled. And then, of course, that new vaccine guidance around COVID that you just mentioned. It all comes down to the health secretary, RFK Jr., who's going to testify later this morning before the Senate Finance Committee. Technically, he's up there for something else, but all of this is very much in the ether on Capitol Hill. What do you hope that members of the committee actually ask him about?
What I'd really like to hear, which I've not heard from him ever, is his reasoning. He's pretty aggressive about certain things. And the way that he speaks, it comes across to me that he really believes what he's saying, which is even more dangerous, because that means that he can't be swayed necessarily by pushing politics or pushing money. It's just going to be simply that he actually believes that vaccines are bad. And I think we really need to sit down and figure out why he believes that and then show him the data, which is so clear. In fact, 1 in 5 children in the United States just 100 years ago did not make it to their 5th birthday. And the thing specifically, there's multiple metrics that show this, that stop that from happening and now allow our children to move forward were vaccines. So he needs to be clear about what he's talking about. And if it's COVID, then let's talk about COVID and talk about the COVID vaccines. And we can discuss things around that. But that is different from saying we don't need MMR vaccines, we don't need polio vaccines. And now he's sliding into an area that he doesn't quite understand.
Well, and it's also an area that he has had pretty consistently anti-vaccine beliefs around. It's not just around COVID. And frankly, senators pressed him on this during his confirmation hearings. And then ultimately, even the skeptical among them got on board on the Republican side and voted to confirm him. Dr. Anitha Duo, we're going to have to leave it there. But thank you for your clarity on this issue this morning.
Thank you. It's a pleasure.